The dorsal group of the foot are the ones we call extensors of the toes, because they cause extension of the toes, basically. And they're all innervated by the deep fibular nerve. So here's the dorsal view of the foot. The first muscle is called the extensor digitorum brevis, which look like this. It originates from the calcaneus of the foot and inserts at the tendons of the extensor digitorum longus at the second, third, and fourth toes. So its function is extension of the second to the fourth toe, as you see here. So that's this one. Then we have the extensor hallucis brevis, which look like this. It originates from the calcaneus and inserts at the tendons of the extensor hallucis longus, and its function is extension of the big toe, pulling it in this direction. So that was all the muscles of the dorsal group, extensor hallucis brevis and extensor digitorum brevis. Now let's do the medial group of the foot. So let's look at it medially. All of these muscles are innervated by the tibialis nerve. So the first muscle is the adductor hallucis, as you see here. It consists of the oblique head, which originates at the base of the second to the fourth metatarsals, the cuboid bone, and the lateral cuneiform bone. The other head is the transverse head, which originates at the third to fourth metatarsopharyngeal joints. Both of them insert at the base of the proximal phalanx of the big toe. Now, this muscle is called the adductor hallucis, so the function of it is to adduct the big toe as well as flexing it. So that's this one. Then we have the flexor hallucis brevis, and this muscle looks like this. It originates from the medial cuneiform as well as from the ligament called the long plantar ligament, which look like this. It's a long ligament that connects the calcaneus with the cuboidal bones mainly. And then it inserts at the base of the proximal phalanx of the big toe, and its function is flexion of the big toe, pulling it in this way. Then there's the abductor hallucis, which is here. This muscle originates from the calcaneal tuberosity and then inserts at the base of the proximal phalanx of the big toe, and its function is, as its name says, abduction as well as flexion of the toe. So that's the medial group. Now let's cover the lateral group, which are the ones on the other side, as you see here. The first one is the flexor digiti minimi brevis, which is this one. It originates from the base of the fifth metatarsals as well as from the long plantar ligament. It inserts at the base of the proximal phalanx of the fifth toe, and its function is flexion of the little toe. So that's this one. Then we have a muscle called the opponens digiti minimi, which is a tiny muscle going underneath the tendons of the flexor digiti minimi brevis, as you see here. This muscle originates from the base of the fifth metatarsal bone as well as from the long plantar ligament, and it inserts at the lateral surface of the fifth metatarsal bone, and its function is adduction and opposition of the little toe, basically pulling it towards the big toe. So that's this one. The last one of this group is the abductor digiti minimi, which is this large muscle here. It originates from the calcaneal tuberosity and at the base of the fifth metatarsal bone, and then it inserts at the base of the proximal phalanx of the little toe, and its function is abduction and flexion of the little toe. So that was the lateral group of the foot. Now let's cover the muscles of the middle group. One thing all of these muscles have in common is that they maintain the longitudinal arch of the foot, and they're all innervated by the lateral and the medial plantar nerves. Alright, the first one is the flexor digitorum brevis, which is this one. It originates from the calcaneal tuberosity, as you see here, as well as from the plantar aponeurosis, which is the plantar ligament that is a part of the fascia of the foot. The flexor digitorum brevis then inserts at the base of the middle phalanx of the second to the fifth toes, and the function of this muscle is flexion of the second to the fifth toe at the middle and the proximal phalanx, as you see here. So that is this one. Then we have the quadratus plantar, which is located underneath the flexor digitorum brevis, as you see here. It originates from the calcaneal tuberosity and the long plantar ligament, and then it inserts at the tendons of the flexor digitorum longus, and is therefore going to participate in flexion of the toes. So that is the middle group. Now let's talk about the interossei muscles. There's a plantar interossei and a dorsal interossei. I will start with the plantar interossei first. The plantar interossei are three muscles located in the second to the fourth interossei space between the metatarsals, as you see here. So we have removed and faded a couple of structures to see them better. These muscles originate from the tibial side of the third to the fifth toes, and they insert at the medial side of the third to the fifth toes. So when these muscle fibers contract, they adduct the toes, basically pulling the third, fourth, and fifth toe towards the second toe, as you see here. and they also assist with flexion of the toes. So that's this one. Then we have the dorsal interossei muscles. There are 4 dorsal interossei muscles located in the 1st to the 4th interossei spaces between the metatarsals, as you see here. They originate between the metatarsals of the 1st to the 5th toes, and they insert at the proximal phalanx of the 2nd to the 4th toe. So when these muscle fibers contract, they abduct the toes, as you see here, basically pulling them away from the 2nd toe. Awesome. So that is these 2. Then we have a system of muscles called the lumbricals, which are here. These are 4 muscles that correspond to the 2nd to the 5th toes. They all originate from the tendons of the flexor digitorum longus, and they insert at the base of the proximal phalanges of the 2nd to the 5th toes on the medial side, and they also insert at the extensor tendons of the 4 lateral toes. The lumbricals are actually a very practical muscle to have, because they give our toes the possibility to flex the proximal phalanges